Many doctors will cut down on the provision of a service or increase its costs in response to disciplinary decisions. And that's according to a recent study evaluating changes in practice behavior regarding the provision of hydrocortisone and lignocaine, or H&L, injections among doctors after a doctor was fined $100,000 for failing to obtain informed consent before such an injection.
Results of the study also highlight that negative consequences of the deterrent effect may subsequently lead to increased social and financial costs that have to be borne by patients and the society. Now, for more on this, we're joined by Dr. Wong Chiang, Council Member and formerly President of the Singapore Medical Association, and Adjunct Assistant Professor Tan Zi, who is President of the College of Family Physicians Singapore. Professor Tan, I'll come to you first. First and foremost, though, can you help us understand the rationale behind the focus on H&L injections for this study?
When we heard of the fine of $100,000, we also heard that there were a number of our colleagues who had great misgivings about it, and they were concerned about potential fallout from this. So they have to make an assessment to see whether or not they would continue to provide this service, and if they were, and at what cost, because they would have to factor in potential medical legal issues regarding this.
Okay. This particular, H&L injection.
Well, H&L injections for a start.
Right. But how often or how common are these injections given in the first place? And, and what kind of a, potential risk do they actually pose?
Well, H&L injections have been given for years. It's something that we do almost without thought. It is one of the procedures that we do quite commonly in a general practice. It's basically a clinic procedure. It's actually very low risk. So many of my colleagues, myself included, I've given H&L injections in the past, and that's never been a problem for us so far. It's just that in this case, once it came out to the medical council, and then it was determined by the disciplinary tribunal that it had not gone right, and the fine had come out, that whole feeling changed. Yeah.
And Dr. Wong, what are your thoughts on how things sort of played out in the end?
Well, first, this study was conducted before the court of 3 judges ruled on the appeal that was made by the SMC on the instruction of the Ministry of Health. And I think the ruling came out last week. So this study sort of predated that. I think things have changed. Even with the grounds of decision given by the court of 3 judges, things may not be the same again. And there's still a certain amount of apprehension, stress amongst the doctors who actually used to give this service or perform this procedure.
So when you say things have changed, could it also be called, maybe some might call it defensive medicine? Because is it necessarily good or bad for patients?
Well, defensive medicine is almost always bad because when there's interaction between a patient and a doctor, it is underpinned by a healthy, what we call a patient-doctor relationship, right? So that is also based on the principle that the doctor wants to do their best for the patient. We are driven to do what we think is best for you. But in defensive medicine, that relationship, the doctor-patient relationship, is replaced or supplanted by a doctor-plaintiff relationship. It means I don't want to do what I do for you is not exactly what I think is the best, but what I do for you is based on my concern that you will sue me and trying to prevent you from suing me. So that's really the essence of defensive medicine. And that's divided into 2 categories, avoidance and assurance defensive medicine. In this case, we have actually, and many people talk about this, but I think this is one of the first time that anybody has actually measured the effect. So as a result of this disciplinary decision, we have measured the effect in a quantitative way. So we have measured that X number of doctors, 164 doctors have stopped giving the service, and this is actually part of what we call avoidance defensive medicine. Even though I know how to do it, even though it's probably indicated, because of the fear of being sued, I don't do it.
So what's then? Sorry.
And the other part of what our study shows is that the cost of the service has gone up. Previously, the median charge was between $0 and $100. And now the median charge, that means the 50th percentile, is now in the $100 to $200 bracket. So it has moved one bracket up.
So the damage seems to have been done then. Is that fair to say, that the sort of negative consequences have come out of that?
We hope that that the verdict by the judges will help to address this, but we really don't know. This, as I said, this study was done before that.
Right, that's right.
All right, well, thank you both for coming in and talking to us today. We've been speaking with Dr. Wong Chiang, council member and formerly president of the Singapore Medical Association, and adjunct assistant professor Tan Zi Li, who's the president of the College of Family Physicians Singapore. Thank you both.
Thank you.
Thank you.